Hi, my name is Amanda, and I'm finishing up my master's degree in health services administration at Xavier University, which is in the United States. Um, my degree is to help prepare me to be a health administrator, which essentially is the business side of healthcare. I'll end up working in management at a hospital, health system, or medical group practice. And among my passions in healthcare are really health equity, eliminating health disparities that exist along racial and socioeconomic status, as well as innovation, technology, and value-based care. And I was one of two of the first interns for the IFMBE, and we recently completed an internship. And now I'd like to turn it over to Logan.
Hi, everybody. My name is Logan. Thanks, Amanda. So I was also in the same program with Amanda at Xavier University. And for me, I'm really passionate about international health, population health, business strategy, and health policy. So really happy to be here today. So interning at IFMBE CED has given us a glimpse into the global clinical engineering community. So as Amanda and I are both healthcare administration students from the States, we came to the internship with a very westernized viewpoint of healthcare. Through our internship, collaborating with professionals from around the globe, we were able to expand our understanding of healthcare to include the broader global community. Specifically, working on creating medical device educational videos for clinical engineers worldwide allowed us to see the differences and similarities in care. So as future healthcare administrators, we hope to implement the knowledge we learned in our everyday decisions and actions, working to continue to advance healthcare for all for years to come.
Yeah, and what has also been really impactful and meaningful for me through this internship with the IFMBE has really been able to be part of their efforts to help build global capacity surrounding clinical and biomedical engineers. We're really at a point in this community where there's really a need to build that future pipeline of CE talent with a focus, especially on having more diversity and more women engineers. It's really important to have that diverse representation, not just of gender, like I mentioned, but also of the diversity of building capacity in those low and middle income countries for this work. As part of our internship, we actually helped to develop an international mentorship program that's still in process right now as part of that capacity building effort. And, especially in the light of the COVID-19 pandemic, global capacity building is just so key. Nations across the world have seen just how critical the profession is to saving human lives, and how capacity building is just critical for global health and for patients, really in the pandemic and, beyond that as well.
So thinking about our potential future collaborations with clinical engineers, this is something really exciting to think about. So just like for me, myself, learning and working with clinical engineers has been super impactful for my future career. So like I said, as a future healthcare administrator, I will have overlap with interprofessional collaborations with CEs. And so while my role and Amanda's role is not the same as an engineer, we will be working on projects that improve patient safety and optimizing digital health initiatives, which is something that's really exciting.
Yeah, and really jumping off from Logan's point here, COVID-19 has really resulted in an explosion of telehealth in the United States and throughout the world. There has been like a rapid standing up and expansion of these digital health programs. And with that expansion, there's going to be an increased need for administrators like us to collaborate in partnership with clinical engineering staff. So from that angle, our internship with the IFMB, it's been absolutely critical to both our futures, and the end result is really going to be a positive impact on patient lives. We just both so loved and enjoyed our time with the IFMB, and we just feel blessed and grateful to have that experience and, to learn about clinical engineering. And we look forward to just in the future being able to collaborate within our own hospitals with clinical engineers. And now we have an understanding of just how important and absolutely indispensable that role is, one of many of the unsung heroes of healthcare.
Mm-hmm.